Good morning, good afternoon, good evening, everyone. Thank you very much for joining us. I am Suad Aden Osman. I work for CoDA. We are here because, as far as we are concerned in the Coalition for Dialogue on Africa, togetherness matters, and matters much more than we value it. Multilateralism as it exists does not deliver for Africa. We all know. This pandemic showed it again. We do not need to wait for more challenges to hit us for us to see. If we wanted to see something different to happen, we have to do something different. And this is very different from where we usually work. Our headquarters is in the African Union Commission in Addis Ababa. We chose to work out of Okada, Edo State, Nigeria. African challenges, for some reason, we kept saying they must be met with African solutions, but we keep turning and going back to the same who have failed us anyways. But at the end of the day, we cannot blame others for pursuing their interests. The pursuit of interests and pursuit of national interests and strategies by governments and their own institutions, multilateral organizations, international organizations, is critical. But with this initiative, what CoDA and Igbinedion University Okada are saying is that non-state actors' views and actions are equally important to assist our governments. This happens when coalitions of the nature of CoDA are dissatisfied with current rules, practices, or missions of existing multilateral institutions, whether they are Africans or non-Africans. CoDA and Igbinedion University or CADA will be combining their respective comparative advantages to bring about a set of solutions we hope will be practical and immediately usable by our governments. I said I work for CoDA. CoDA stands for the Coalition for Dialogue on Africa. It is a platform for dialogue and debate, frank, open, inclusive, at times very controversial dialogues and debate, and on very rare occasions, we step in to see through the pursuit of policies. We did it on transnational borders crimes. We did it on climate change. We did it on land management. We did it on illicit financial flows. We did it in the fight of anti-corruption. We are now doing it for our own health. It's very precious. We feel it is time we also poke our nose in this. And what the coalition is actually governed by a board currently chaired by His Excellency Olusegun Obasanjo, former President of the Republic of Nigeria. What two sons of this country, His Excellency Olusegun Obasanjo and the Esama of the Benin Kingdom, of course supported by my very close friend and brother, Chief Lucky Nosahaye Igbinedion, Deputy Chancellor of Igbinedion University, is to create an alternative. We can call it what we want, initiative, platform, whatever, but we need this alternative. And we needed it now. We needed it forcefully, we needed it funded, we needed it anchored in an institution like Igbinedion University. So what these two sons, great sons of our continent are doing is to allow Africans to pursue the policies and the practices that we hope will be different from those of existing international institutions. I do not want to preempt what is going to follow. I wanted to welcome you to the second policy dialogue of CoDA. I am Suad Aden Osman, but for the most of you, since you heard Obasanjo and Igbinedion, please, you can also call me Suad Obasanjo Igbinedion, because we do need the sons and daughters of Africa to stand up and say this is enough. We can do it, we can get it done. And to use the words of my brother, Chief Lucky, let us show them we can succeed without going the usual way. So we are stepping aside from the beaten paths. Let us explore what we can bring about. Thank you very much for coming.
And it's my honor and privilege to welcome His Excellency Chief Olusegun Obasanjo, former President of the Federal Republic of Nigeria and Chair of the CoDA Board of Directors, who is unavoidably absent due to continental assignments, but is here represented by Professor Abdoulaye Bathily. Professor Bathily is a former UN Under Secretary General and head of the UN office in Central Africa. He is also the founder of CoDA. So ladies and gentlemen, please join me to welcome Professor Abdoulaye Bathily, who is here representing His Excellency, the former President.
Madam Deputy Chair of the African Union Commission, Excellencies, the Esama of Benin, ladies and gentlemen, all protocol observed. I quote President Olusegun Obasanjo. I am greatly delighted as chair of a coalition for dialogue on Africa and as an African who needs the vaccines to welcome you all to this epic occasion to launch the Independent Task Team on Equitable and Universal Access to Vaccines and Vaccination in Africa. Just 2 months ago, we held a dialogue involving the academics, researchers, scientists, public health experts, youth, civil society, faith leaders, and community leaders to discuss how to increase access to vaccine and vaccination in Africa. During that dialogue, I had pledged my commitment to ensuring that recommendations from the dialogue are implemented and with speed. I am glad to let you know that today's launch is in fulfillment of that promise, and it marks the beginning of new partnership and collaborations that will see our continent play a lead role in vaccine development, production, and distribution. I would like to express my gratitude to Igbinedion University Teaching Hospital, Okada, for accepting to host this initiative by providing a center through which activities will be coordinated with CoDA. I salute their courage despite the uncertainty currently surrounding the issue of vaccine globally. I also thank everyone who has been involved in putting ideas to work for the takeoff of the initiative. I have always believed that Africa's main challenge is not the lack of funds or resources. Our main challenge is the inability to harness available resources to provide customized homegrown solutions needed to address the challenges we see across the continent. Many of our researchers, doctors, nurses, and other healthcare workers are constantly being drawn out of the continent to serve in other continents. They use their intellect to serve the needs of other continents, and most times without being duly credited or acknowledged for their intellectual investment. We need to reverse this trend and begin to take actions to harness our local resources to solve our local problems. Through initiatives like this one, Africa will be able to encourage and retain its talents and support them in finding solutions to its age-long healthcare challenges. The initiative we are launching today is one of those initiatives that will help Africa look inwards to identify and channel available resources to areas where they are needed. This initiative has the potential to positively change the vaccine and vaccination landscape across the continent and set precedents for vaccine entrepreneurship in the continent. If we carefully nurture the initiative to maturity, we will have laid a good foundation for a healthier Africa, using largely resources from within the continent. My advice today to everyone present in this launch and to those who will watch the event later via social media or learn about it through the news is to emulate the extraordinary example of EQUITABLE University by joining this unique partnership to rewrite the story of vaccine and vaccination in Africa. Through partnership and collaborations, the scope and outcomes of the initiative can be broadened to make more meaningful impact on the lives of our people. I look forward to seeing this initiative translate into better health care for Africa and for the Africans. Thank you very much for listening. End quote, President Olusegun Obasanjo. Thank you.
We will take the statement by Professor Benedict Orama, President and Chairman, Board of Trustees of Afrexim Bank, and Chairman, Board of Trustees of the African Union COVID-19 Response Funds.
Your Excellency, Chief Olusegun Obasanjo, former President of Nigeria and Chair of the CoDA Board of Directors, Your Excellency and dear sister, Dr. Monique Nsanzabaganwa, Deputy Chairperson of the African Union Commission, Your Excellency, Chief Lucky Winedion, former Governor of Edo State, Nigeria, and Deputy Chancellor and Deputy Chairman, Board of Regents, Winedion University, Your Excellency, Ms. Saud Aden Osman, Executive Director of CoDA, fellow CoDA board members, distinguished task team members, ladies and gentlemen. Permit me to begin by expressing my appreciation to the chairperson of the Coalition for Dialogue on Africa for the opportunity to make remarks at this launch event of the CoDA Independent Task Team on equitable and universal access to vaccines and vaccination in Africa. Afrexim Bank is proud to be a co-organizer of this event along with CoDA, the African Union, and the Winedion University. We do so with a great sense of responsibility, having committed an amount of $2 billion that made it possible for the African Union's Africa Vaccine Acquisition Task Team to conclude a 400 million COVID-19 vaccine doses deal with Johnson & Johnson. With over 5 million infections and 135,000 deaths as at June 15, COVID-19 pandemic remains a significant public health concern for Africa. The dual public health and economic shock threatens to disrupt Africa's growth prospects for years to come. Already, African economies are estimated to have contracted by 2.1% in 2020. the continent's first recession in 25 years. Africa's trade also contracted by about 12%, reversing the strong growth the continent achieved over the past 2 decades. The long-term socioeconomic impacts of the pandemic are also likely to be extremely severe and protracted for African economies unless the spread of the virus is contained. With the virus maintaining its spread and new variants emerging, experts say that the best approach to effectively overcome the challenge lies in the widespread production, distribution, and administration of affordable vaccines. However, and despite having 14% of the world's population and being the region that is disproportionately affected by infectious diseases, Africa accounts for less than 0.1% of the world's vaccine production capacity. As a result, history is repeating itself as the struggle for access to the COVID-19 vaccine rages. With very limited vaccine production capacities and vaccine nationalism as the name of the game, Africa faces an uphill task in bringing the virus under control and regaining control of its economies. Most countries in Africa relied upon the goodwill of the international community, especially through the Gavi-COVAX vaccine sharing platform. However, thanks to vaccine nationalism, export restrictions, and unfulfilled donor pledges, the timeline and scale of delivery of existing arrangements is highly uncertain, even today, threatening COVID-19 vaccination programs across the continent. It is no wonder then that while the UK, Europe, and the US are well near fully vaccinating more than half of their populations, Africa is yet to vaccinate 3% of its people. The evolving situation is contributing to a COVID-19 vaccination-linked development gulf that will further exacerbate global income inequalities and challenge the attainment of sustainable development goals. Your Excellencies, distinguished ladies and gentlemen, as an institution that was from the beginning at the forefront of the struggle to help the continent contain the health and economic impact of the pandemic, we saw firsthand the weaknesses and severe vulnerabilities of Africa and Africans. The risk of overdependence on global supply chains for the simplest of healthcare supplies crystallized in very dramatic ways. From personal protective equipment to test kits, from therapeutics to vaccines, Africa was never in control of critical anti-COVID-19 supplies. And despite having money available, we were still not able to respond as we remain reliant on supplies from outside. While the pandemic is tragic, it can also be instructive and has provided an opportunity for Africa to take its destiny in its own hands. While the pandemic is tragic, it can be instructive and has indeed provided an opportunity for Africa to take its destiny into its own hands. The pandemic has demonstrated what Africa is able to achieve when its people come together and support its institutions. The proactive measures launched by the African Union significantly contributed to mitigating the health impact of the pandemic. Sizable financial and in-kind resources were mobilized through the AU COVID-19 Response Fund and Africa CDC. Our President Bank also collaborated with Mr. Strive Masiyiwa, AU Special Envoy, Africa CDC, and the UN Economic Commission for Africa to set up and operate the Africa Medical Supplies Platform, a digital platform that is being used to facilitate pooled procurement and equitable distribution of COVID-19 supplies, including vaccines. It also created market access opportunities for African manufacturers of medical equipment and supplies. His Excellency Mr. Cyril Ramaphosa, President of South Africa and then Chair of the African Union, established the African Vaccine Acquisition Task Team, tasked with procuring vaccines arranging the financing and distributing the vaccines on a pooled whole-of-Africa basis. Due to extreme vaccine nationalism prevailing worldwide, the Africa Vaccine Acquisition Task Team worked with Afreximbank to arrange $2 billion facility needed and facilitated access to up to 400 million doses of vaccines for Africa, a large proportion of which is being manufactured by Aspen Pharma, a pharmaceutical company in South Africa. This financing complements the amount of $6.5 billion Afreximbank disbursed in support of the effort to contain the COVID-19 pandemic. The $2 billion vaccine deal AVAT concluded with the support of Afreximbank is a game changer for the continent. It marked the first time Africa has responded with such magnitude in a matter of such significance. We as a people decided to take our destiny in our hands, rather than to be numbed by the drunkenness of endless pledges. And by stepping up to create a structure for a pooled procurement and demonstrating responsibility, significant support has come. For instance, just a few weeks ago, Mastercard Foundation has donated $500 million to support the procurement of Johnson & Johnson vaccines by African Union member states through the African Union Vaccine Acquisition Task Team platform. The US government has also announced significant donations of vaccines to the AU through the same platform. While all these are commendable, we understand that we need to do more to ensure widespread access to vaccines by our people. Universal access requires investments in delivery infrastructure, ancillaries, and people. It also requires considerable investment in education. That is why we need to bring together stakeholders, including African public and private universities, research institutions, as well as the African private sector in facilitating access to vaccines and vaccination in Africa. It's only through such efforts that we will accelerate the implementation of the African Union's Africa Vaccine Strategy and ensure that these vaccines reach all our communities in good time. We therefore welcome the establishment of the task team, which is a direct outcome of the dialogue we held in April this year that included a myriad of stakeholders, namely the private sector, faith leaders, and the youth. I'm particularly pleased that this task team has been established. Afreximbank welcomes being a part of the team. It is through such engagements and initiatives that we will take collective ownership of our destiny and ensure that we turn the tide against the pandemic. We congratulate the Bunejo University for the vision of hosting this event and supporting the initiative. I wish the task team the greatest success and thank you all for your kind attention and for the opportunity to speak here today. Thank you.
Your Excellencies, distinguished guests, ladies and gentlemen, please join me to welcome at this point Her Excellency Dr. Monique Nsazabaganwa, Deputy Chairperson of the African Union Commission, to give a statement.
Your Excellencies, the Esama of Benin, ladies and gentlemen, greetings from the African Union Commission. Allow me, Your Excellencies, to first of all thank the Esama of Benin for his hospitality and also for hosting this important occasion. On behalf of the chairperson of the African Union Commission and the entire leadership of the Commission, I welcome every one of you to this milestone event to launch the Independent Task Team on Equitable and Universal Access to Vaccines and Vaccination in Africa, and the official commencement of activities by the task team. It's a great pleasure to witness this historic event that heralds a renowned involvement of private universities in helping to find solutions to the challenges associated with vaccines and vaccination in Africa. Universities and research institutions are established as citadels of learning and excellence and centers of intellectual prowess capable of leading research and discoveries on issues affecting human lives. However, for some reasons, public health research in Africa has suffered from some setbacks in the past few decades, partly because of insufficient investments in research and development, and the gap between public health research, the private sector, and public policy in Africa continues to widen, partly because the African private sector has not shown sufficient interest in health sector research and development. Public health research is indeed capital intensive, but we must also realize that health business is everyone's business, judging from our experience with the COVID-19 pandemic. Apart from the lives lost, the private sector has been greatly affected, and that tells us that if people are sick, businesses will also be sick. The private sector is the spirit of any nation because they give direction to human and economic development. When businesses don't play their role of uplifting the morale and helping to raise living standards, they lose their relevance. It's therefore essential for the African private sector to be involved in public health research that will help find solutions to the health problems on our continent, most importantly, at this time, the limited access to vaccines and vaccination. Strengthening Africa's health systems requires a convergence of the private sector with policy, the community, the civil society, and healthcare practitioners. I'm very much delighted that Igbinedion University, or CoDA, is taking up the challenge to champion this new initiative that will help increase the research, development, and distribution of vaccines in Africa. I'm confident that this new platform will help bring the relevant stakeholders together to dialogue, consult, and come up with great ideas and actions that will raise public health in Africa to a whole new level. And this private sector-led initiative being launched today as a partnership with the Coalition for Dialogue on Africa and Ignatian University. And it's a wake-up call to other private universities and businesses in Africa to contribute towards strengthening healthcare provision across the continent. Strengthening healthcare provision is not just about making donations, but should also include addressing the root cause of our healthcare problems, one of which is research and development. I salute the courage of the founders and management of Ignatian University for accepting the challenge, and I call on other private sector players in Africa to join the coalition by making meaningful investments in vaccine research and development on the continent. I'd like to assure you of the commitment and support of the African Union Commission towards the success of this laudable homegrown initiative targeted at improving healthcare in Africa by improving access to vaccines and vaccination. I thank you and also congratulate you on this occasion. Thank you so much.
Thank you very, very much, Deputy Chairperson. We appreciate you. Your Excellencies, distinguished ladies and gentlemen, at this point, I'd like to welcome the #1 citizen of Edo State, His Excellency Godwin Nogegase Obaseki, to the podium. Your Excellency, sir.
Your Excellency, the former head of state of Nigeria, Chief Olusegun Obasanjo, GCFR, who is ably represented here this morning by the chairman for the Coalition for Dialogue on Africa, CoDA. Who is represented by Professor Bitney. Your Excellency, the Deputy Chairman of the African Union Commission. Your Excellency, the High Commissioner of South Africa to Nigeria. Your Excellency, the former Governor of Edo State, Chief Gabriel Igbinedion, who's also Chancellor of Igbinedion University, Okada. Our father, His Excellency Chief Gabriel Sawaru Igbinedion, the Isama of Benin Kingdom, whose foresight and vision has made it possible for us all to be seated here in this hall this morning. The Executive Director of CoDA and other members of CoDA who are here present, distinguished ladies and gentlemen. I'm very, very glad to be with all of you this morning to host in Edo State this very important launch of the Independent Task Team for the Coalition for Dialogue on Africa, CoDA, on the equitable and universal access to vaccines and vaccination in Africa. As you are all aware, the recent outbreak of coronavirus disease, COVID-19, across the globe, with its attendant threats to the social and economic survival of even the most stable economies, have caused nations and leaders of the world to rethink the importance of effective measures for the control of communicable diseases, of which vaccination ranks as perhaps the most efficient and sustainable intervention. Vaccines have helped the world to deal with the various debilitating ailments and potentially devastating infections and diseases that could have spiraled into pandemics and spelled global doom. And such diseases as polio, smallpox, meningitis, pneumonia, and diarrhea among several others. Most of these ailments have been totally eradicated or brought under substantial control with the help of vaccines. But unfortunately for Africa, the full benefits of vaccines have not been brought to bear in the management of diseases and infections. This is evidence in efficacy in curtailing deadly infections in other parts of the world. For example, malaria, a tropical disease that is prevalent only in Africa, still kills up to 1 million children every year. About 40 million people are living with HIV/AIDS globally. Nearly 70% of them are here in Africa. Despite the best efforts of the World Health Organization and other development partners, we are yet to develop effective vaccines against these two deadly diseases, malaria and HIV. Also noteworthy is the fact that by March 2021, 1 year after the shutdown of the global economy as a result of the outbreak of COVID-19, less than 2% of about the 1.4 billion doses of COVID-19 vaccines which have been given globally have reached Africa. Therefore, the launch of an independent task team on the equitable and universal access to vaccines and vaccination in Africa, the initiative of the Coalition for Dialogue on Africa, CoDA, and its partners, is therefore occurring at the right time in the history of vaccines and vaccinations. These inequities have been described variously as shameful, scandalous, and a crisis within a crisis. Over 80% of the COVID-19 vaccines which have been administered globally have been taken up by high and middle income countries. Like I said, only 2% have gone to low income countries. It is heartwarming, therefore, that CoDA and the African Union and the African Export-Import Bank, collaborating with the Benedict University, have decided to address this healthcare challenge in Africa in a bid to achieve equitable access to vaccines and vaccinations on the continent. In Edo State, our government is currently implementing a wide-ranging healthcare reform which is geared towards achieving high-quality healthcare and universal health care coverage for our people. Consideration for equity in access to healthcare commodities and technologies are at the heart of our reforms, especially for the vulnerable and underrepresented groups. I have personally been on the front line of Edo State's COVID-19 response since March 2020, And we have over 62 vaccination teams working in all our 18 local governments. We have vaccinated over 38,000 of our citizens out of our target of 47,944. This achievement is still very, very low because it represents less than 0.001% of the 5 million people who live in Edo State. The area we hope that CoDA will also emphasize will be how to strengthen our primary healthcare systems and governance structures on the continent, such that we can also focus on the area of vaccine hesitancy. It is one thing for us to have access to the vaccines, is another to convince our people to take these vaccines to provide the cure required. But I assure you that Edo State will partner with CoDA and all the other veritable collaborators in the task ahead, particularly that of achieving equitable access to vaccines and vaccinations in Africa. I therefore, once again, welcome you to Edo State. We have the institutions and the human resources, just as you're seeing here in the Benedict University, and the wherewithal to support the initiatives which you have brought about and strengthening our institutions such that we can achieve equitable access to vaccines and vaccinations in Nigeria. We can assure you that you have our total unallowed support. We look forward to a fruitful partnership with all the stakeholders, and especially with the soon-to-be launched independent task team on equitable and universal access to vaccines and vaccinations in Africa. Thank you very much for inviting me.
We will have the statement by the Honorable Minister of Health of the Federal Republic of Nigeria, Dr. Osagie Emmanuel Ehanire. He will join us virtually.
Thank you very much, MCs, Your Excellency, the Governor of Edo State, Governor Obaseki, the representative of the Chairman of the Board of CoDA, His Excellency Olusegun Obasanjo, former President of Nigeria, the Chancellor, Deputy Chancellor, and Vice Chancellor of the Benedict University, other dignitaries present, I wish to rest on existing protocol. It is my privilege to be part of this important event to launch the independent task team on equitable and universal access to vaccines and vaccination in Africa. It is commendable that the Coalition for Dialogue in Africa, CoDA, is collaborating with reputable Benedict University Teaching Hospital to profile solutions to perhaps the most intractable subject matter confronting Africa in responding to the COVID-19 pandemic. This being getting access to COVID-19 vaccines. The Federal Ministry of Health has also been working on this subject since last year. Since establishment of the Coalition for Dialogue on Africa, CoDA, in March 2009, as a special initiative of the African Union, the African Development Bank, the African Export-Import Bank, and the United Nations Economic Commission for Africa, we have closely followed their activities around high-level policy forums to support dialogue on Africa's peace and security, governance, and development. Their interventions are of high value to Africa. For an organization led by our own former president, Olusegun Obasanjo, we do not expect anything less, as he is one of the foremost Pan-Africanists today. The COVID pandemic did not only take lives, but also caused global economic devastation and damaged livelihoods, as countries were forced to temporarily shut down economic activity, causing loss of income and associated tax revenue, particularly in Africa with a large informal sector economy. The travel and tourism industry also crashed, and foreign direct investments and remittances were significantly reduced. Vaccines quickly became a commodity of highest global value to address COVID-19 and the best hope of ending the disease, alongside critical containment measures that countries had instituted. But procuring and administering the vaccine are, however, costly exercises that put African countries at disadvantage due to restricted access to the market and to financing. As the novel coronavirus rapidly spread across the World Health Organization declared it a public health emergency of international concern on 30th of June 2020, with Nigeria recording its index case on February 27, 2020. The federal government took steps to contain it in a whole of government approach around the Presidential Task Force on COVID-19, now known as the Presidential Steering Committee, that brings relevant ministries and agencies together to set public health measures and non-pharmaceutical protocols to support other technical measures. Signing the Coronavirus Disease Health Protection of 2021 regulations is a product of this effort. The Federal Ministry of Health also took strategic steps with the Nigeria Center for Disease Control at the forefront, the Federal Ministry of Health Department of Public Health Services at points of entry and service delivery in our hospitals, as well as the development of a national health sector COVID-19 pandemic response action plan. Thankfully, the efforts have yielded results, and the gloomy predictions about Africa and Nigeria in particular have so far not come to pass. We continue to strengthen our response mechanisms to ensure that COVID-19 remains under control. However, we must not rest on our oars, and we are not yet out of the woods. On vaccine access, the Federal Ministry of Health evaluated indigenously developed candidate vaccines and vaccines with World Health Organization emergency use listing. While vaccine nationalism evolved around other parts of the world, such that access was prioritized to favor wealthy countries to the detriment of developing countries. The Federal Ministry of Health then convened a national COVID-19 vaccine conference to mobilize experts, development partners, and other stakeholders to create a unified and strategic national front for vaccine acquisition and vaccination of Nigerians. This exercise has been going on smoothly. The pandemic appears to be receding in wealthier nations with easy access to COVID-19 vaccines. But vaccine coverage in African countries have been put off to a low start due to inequitable distribution and fiscal constraints. The supply is outstripped by global demand, especially in low-income countries. Africa being worst hit, with barely 2% of the population vaccinated, compared with 30 to 60% in developed countries. The coming together of African countries to push as one for vaccine availability for the entire continent is an excellent approach, which Nigeria subscribes to under the African Vaccine Acquisition Task Team, AVAT, and registered to access vaccines for 50% of our population. We also subscribe to the COVAX facility, aiming to provide vaccines for the first 20% of the population of 92 member countries. We also support the ECOWAS strategy and initiative, of which President Muhammadu Buhari is a COVID-19 champion, to ensure our region is well provided for. As the DG of the World Health Organization repeatedly says, no one is safe until we are all safe. On the 24th and 25th of June 2020, Africa CDC hosted a conference of Africa's leadership role in COVID-19 vaccine development and access, which brought over 3,000 political leaders and technical experts together to discuss our COVID-19 vaccine needs and regional opportunities to drive vaccine development, manufacture, distribution, and uptake. Based on the inputs of leading public health experts across the continent, these targets were developed as follows: successful immunization of a critical mass of Africa's population with one of several vaccine and efficacious COVID-19 vaccines. Accelerate African involvement in the clinical development of a vaccine to ensure African countries access a sufficient share of global vaccine supply, to remove barriers to widespread delivery and uptake of effective vaccines across Africa, and to access financing and procurement. Global negotiations for supply rights and access to future vaccines are already underway. The concept of vaccine multilateralism, championed by the Global Alliance for Vaccines and Immunization, Gavi, the World Health Organization, and the African Union, presents a promising opportunity for Africa to secure a contingency share of global vaccine supplies. The African Export-Import Bank, AFREXIM, is facilitating payments for COVID-19 vaccine by advanced procurement commitment and guarantees up to $2 billion to manufacturers on behalf of member states. The AVAT has already secured the promise of 400 million doses of a variety of vaccines for deployment in Africa. But timely delivery is turning out to be an issue due to the low prioritization of Africa for vaccine delivery. It is in this respect that I see one of the great opportunities for the independent task team on equitable and universal access to vaccines and vaccination in Africa to engage the global gatekeepers of access to vaccines to do the needful for health workers, the elderly, and the vulnerable in Africa to access COVID-19 vaccines before it is too late to do the good it is meant to do. Beyond AVAT, the COVAX facility is raising an initial $2 billion from global donors for vaccine subsidy for low and lower middle income countries through advanced market commitment, with plans to raise even more as needed to procure vaccines for Africa at no cost to us. COVAX thus offers multiple benefits to members, including a diverse vaccine portfolio and equitable access for member states to cover up to 20% of their population. To augment COVAX benefits, the African Union also engages manufacturers for supplies of more vaccines. For this, substantial capital is to be mobilized from donors and domestic sources, of which estimates range from $16 billion to $21 billion for 50% of Africa's population and to cover the delivery of vaccines. African governments shall consider ways of independently financing and delivering the vaccine in the short and medium term without compromise of other priority expenditure, especially of health programs. Resource reprioritization may in fact benefit the economy as a whole if governments use it as an opportunity to reevaluate spending plans and direct funds from non-priority or loss-making programs. Africa, with 54 countries and 1.2 billion people, produces barely 1% of vaccines it administers, with perhaps 99% imported. Challenges of financing, empowering regulatory bodies to meet global standards, raising research capacity, and getting advanced government procurement commitments can be surmounted if there is unity of purpose in Africa. Our continent now has a unique opportunity, not to be missed, to press for manufacturing capability for COVID-19 vaccines to satisfy the needs of the continent. Nigeria will bid for international support to produce COVID-19 vaccines for Africa, an initiative for which I hereby also solicit support from the Independent Task Team on Equitable and Universal Access to Vaccines and Vaccination in Africa, since we have learned, as part of the lessons from COVID-19 experience, that we cannot indefinitely continue to depend on developed countries for vaccines and other critical supplies. National strategy and capacity must be used to support us for Africa's entry to the vaccine production age. I also lay this on this as the second most important request for the Independent Task Team on Equitable and Universal Access to Vaccines and Vaccination in Africa to consider. As we push for COVID-19 vaccines for the continent, we must also address the question of hesitancy, even among health workers, who I hereby implore to use their positions to advocate for and promote vaccine uptake in view of the COVID-19 resurgence in the African region following Asia. As we fight this disease, we must translate lessons to policies to save lives and livelihoods. Thank you very much for your attention, and I wish you all a successful launch of this novel initiative.
Thank you very, very much, Honorable Minister. We appreciate your support for this project. Distinguished ladies and gentlemen, let us welcome in a special way His Excellency Chief Lucky Nosakare Igbenedion to the podium.
I stand here with the full authority of our founder, our father, Sir Gabriel Osawari Igbenedion, the Chancellor of Igbenedion University and Igbenedion University Teaching Hospital. Your Excellency, my brother, the Governor of Edo State, Godwin Obaseki. Your Excellency, our former Head of State, President, Chief Olusegun Obasanjo, who is ably represented by His Excellency Abdullahi Batili, the co-founder and board member of CoDA. Her Excellency Dr. Monique Sazambagwa, Deputy Chairperson of the African Union Mission. Professor Benedict Orama, President and Chairman, Board of Trustees, Afro-Exim Bank, and Chairman, Board of Trustees for the African Union 19 COVID response. Our Honorable Minister, Dr. Osage Ehanire, Minister of Health, the Federal Republic of Nigeria. Ms. Swad Aden Osman, Executive Director, Coalition of Dialogue on Africa. Very distinguished dignitaries here present, including our own very brother, the High Commissioner of South Africa to Nigeria. Distinguished ladies and gentlemen, it is with great pleasure that I bring you these few words on the launch of the CoDA Independent Task Team on the development of vaccines and equitable universal access to essential vaccines and vaccinations in Africa. Let me first thank all of you who have honored the invitation to attend this launch. I am impressed by the attendance, physically and online, and this gives me the assurance that Africans are very much eager to see some transformations and upward thrust in the public health space across the continent. I congratulate the Coalition of Dialogue on Africa, the African Union Commission, Afro-Exim Bank, and other partners for organizing this program in partnership with Igbinedion University Teaching Hospital, Okada, Nigeria. Africa has experienced several diseases, outbreaks, and epidemics in the past. We all remember the Ebola virus disease outbreak in parts of West Africa in 2014 and 2015, and the repeat of Congo and the new outbreak that was reported this year in Guinea. Apart from this, we have seen several outbreaks of cholera, yellow fever, Lassa fever, Rift Valley, listeriosis, and many more on the continent. And now, the most severe of them, the COVID-19 pandemic, which has affected every country and has negatively affected every aspect of human life. This long list of infectious diseases tells us that Africa will always experience one outbreak or the other that has the potential to disrupt human life and activities. As we have seen the COVID-19 pandemic, it also tells us that Africa must take definite and urgent actions to enhance response to epidemics, pandemics, and disease outbreaks. It further tells us that Africa must own and control its public health response to make it applicable to its populations. Although Africa is least affected by the COVID-19 pandemic, it has the most disadvantage in terms of response because of scarcity of the simple tools needed for appropriate response, such as intensive care units, medical oxygen, ventilators, personal protective equipment, test kits, and most importantly, at this time, vaccines needed to vaccinate the populations. This scarcity has been because Africa manufactures only a little fraction of its medical equipment and health commodities supplies. With only about 1% of its population fully vaccinated against COVID-19, Africa is far behind in vaccination. It is the continent with the lowest number of fully vaccinated persons. This is unacceptable. In a continent of about 1.3 billion people, who have very high intellectual capacity and vast resources. I am, however, happy that all hope is not lost. We still have a great opportunity to salvage our health system and strengthen our public health emergency response. With the support of the African scientists, the world now has a vaccine against Ebola virus disease. Africa currently manufactures vaccines for yellow fever and some of the infectious animal diseases. The continent has some of the best scientists. I repeat that, the continent has some of the best scientists in the world, some of whom have been involved in the development of the current COVID-19 vaccines. It is my belief that Africa can build on the current progress in vaccine research, development, and manufacturing to solve the problems of infectious diseases on the continent by scaling up research and building capacity towards production and manufacturing. On this note, Igbinedion University Okada is delighted to champion this new initiative that will facilitate the development, manufacturing, distribution of vaccines in Africa. And we are fortunate to have found a suitable ally in CoDA, an institution with a similar vision and ready to work with us on this laudable initiative. We recognize other actions currently being taken by African Union, African CDC, the World Health Organization, the other partners across the continent. And I would like to emphasize that our initiative is not meant to duplicate what is already being done. The initiative will complement all other efforts to ensure that Africa becomes self-sufficient in vaccine development and production. We recognize the inability of the African Union, member states, and intergovernmental institutions to provide all the solutions to Africa's vaccine problems. And that is why Igbinedion University and other private sector institutions are coming together to create a platform to engage on policy research and manufacturing that will pave the way for the development and production of essential vaccines in Africa. We will certainly require the support and partnership of other academic research and philanthropic institutions, as well as the community and faith leaders, the civil society. We will be reaching out to them with the support of CoDA to ensure that our solutions and initiatives are holistic and people-focused. We will also be working with the African Business Council and other private sector initiatives to ensure full actualization of this vision, of this initiative. As part of the initiative being launched today, Igbinedion University is setting up a center of excellence that will foster partnerships and collaborations on equitable and universal access to essential vaccines and vaccinations in Africa. At Igbinedion University, we do not believe in too much talking. We are more interested in the results from any initiative we are involved. Therefore, the university is committing enormous resources to ensure a successful takeoff of the initiative and will continue to do so in every way with our means to nurture it to maturity. This initiative is the result of a series of consultations between CoDA, Board of Directors led by His Excellency Chief Olusegun Obasanjo, and the relevant institutions and individuals. I am delighted that what started as an over-the-coffee discussion is today transforming into an independent continental platform that will better prepare Africa to respond to public health emergencies in the future and help improve lives and livelihoods across the continent. I am delighted that Igbinedion University could champion such very important life-saving program for Africa. Through the initiative, we hope to attract high-caliber scientific and research experts from the continent and around the world to advance vaccine research, development, and manufacturing in Africa. I would like to assure you that Igbinedion University is not taking this initiative lightly. It is for one of those essential initiatives that Africa must undertake to further advance and strengthen its health systems. And we are fully prepared to nurture it to global success. Every journey must start with a step. And Igbinedion University is happy to take this major step with CoDA towards transforming public health and ensuring continent-wide availability and access to essential vaccines and vaccinations in Africa. This is a huge undertaking that will require cooperation from everyone, particularly the private sector. And I'm using this opportunity to appeal to private and public universities, as well as research and other private sector institutions in Africa to join us in this journey of vaccine industrialization in Africa. Remember, business can only thrive in a healthy environment. And one way to ensure that we create that environment is to make essential vaccines available to the public in quantities that are adequate and available when and where they are needed. Join us in this historic initiative to rewrite the story of Africa from being totally dependent on foreign sources for its human vaccine needs to becoming self-sufficient in vaccine production. With sincere thanks for your attention, it is now my honor and privilege to officially launch the CoDA Independent Task Team on development of vaccines and equitable universal access to essential vaccines and vaccination in Africa. Thank you for listening, and God bless all of you.
At this point, as it is in our program, there will be the signing of the MOU between CoDA and the Igbinedion University Teaching Hospital. And to make this happen, His Excellency Chief Lucky Igbinedion will be on the side of IUTH, supported by Dr. Bazwaye, the Chief Medical Director of IUTH. And for CoDA, we have the Executive Director of CoDA, Meswad Osman, who will be joined by the board members, Professor Abdullahi Bachili, who just represented our former Head of State Chief Olusegun Obasanjo, and Dr. Amani Asfo, Head of the African Business Council, and also a member of the CoDA board. Commitments from all the stakeholders, particularly also that the governor of Edo State also pledged his support for the project. We believe that this project will not be another talk shop, will not end as another talk show, but one designed to see the light of day, saving the lives of Africans. And that's how it will go. The signing is taking place, and this becomes a proper working arrangement at the instance of CoDA, an organ of the African Union, which means it's an African project. It's not a project only of the EQUITABLE University Teaching Hospital or EQUITABLE University. It's a project involving all the countries on the African continent. And the call has gone forth already to all stakeholders. And all stakeholders are all Africans, as a matter of fact. The public, the private sector have been called upon to work together to make this reality. We have the best brains. We have exported skills, professionals. Our health experts have designed vaccines. Even the ones that are being sold by multinationals from other continents have inputs from Africans. So we believe that if they can do this overseas, if they can do this in foreign countries, given the right environment and encouragement, which is what we are witnessing today at the instance of the African Union, backed by the EQUITABLE University and the EQUITABLE University Teaching Hospital, to start this initiative, to take Africa out of that beggarly situation. We all know this statement that the beggar has no choice. You take whatever you are given. At this point, after the signing of this document, Africa wants to work together as a team. Not east, west, central, south, and we want to work as one Africa. That's the essence of what is going on now. So that as one indivisible block, as one united entity, a common vision will be pursued. And that is the vision for the development of vaccines and equitable universal access to essential vaccines and vaccinations in Nigeria. The document has just been signed. Congratulations. Congratulations to CoDA. Congratulations to the EQUITABLE University Teaching Hospital. Congratulations to all Africans. May we give CoDA and the EQUITABLE University a big round of applause, ladies and gentlemen. This is how we should work as a continent. This is how we should work as a people. At this point also will be the unveiling of the statues presented by the EQUITABLE University, the EQUITABLE University Teaching Hospital, to the African Union. And we already have right there the Deputy Chancellor and Chairman and Deputy Chairman, Board of Regents, EQUITABLE University Okada, His Excellency Chief Lucky Nosaka EQUITABLE, to do the needful. May we appreciate this by a big round of applause. The rich culture of Edo Kingdom. It talks about the hospitality of Edo people. And whoever visits the African Union headquarters in Addis will know that something came out of Edo. And that statue is being unveiled by the representative of His Excellency Chief Olusegun Obasanjo, former President of the Federal Republic of Nigeria, and will be presented by the Honorable Vice Chancellor to CoDA. I'm sure we can do better. May we give a better round of applause, ladies and gentlemen. CoDA has put together a very high network of professionals drawn from across the world of African descent and beyond to work on this noble initiative. And we have no doubts at all that this will work the way it should.